To Nyeri County, where Martin Munene is standing by looking at the transport sector. We understand that the operators have been instructed to ensure that there is hand sanitizer in their vehicles, and also to ensure that the vehicles are washed regularly to ensure that should the virus get into contact with those facilities, then it is well kept at bay. Now, good morning, Martin. What have you seen? And are people observing the hygiene standards as set out by the Ministry of Health and the government at large?
All right, a very good morning to you, Sam and Zinzi from Nyeri County. Like you said, we are actually at the largest bus stop in Nyeri County, and we've been going around to just see what is happening. And one of the things that we've realized is that a lot of the operators here are saying they've been trying to get sanitizers, they're not able to get them, but now they have had to just use what has been said can actually help: basic water and soap. And so where I am, Sam, I'm just going to be showing you what is happening from where I stand. If you look from this side, you'll see there's a tank here. There's somebody here, one of the operators helping somebody get soap from from a dispenser, and then they have actually a bucket here that is full of water, and then the gentleman proceeds to clean his hands, because this is one of the things that has been actually said to be helpful. And apart from that, they also get something to use, a tissue, and it's disposable instead of each person using the same thing. And I understand from the operators here, this is what they have been doing, and I want to speak to one of them so that we understand if there's anything else that they're doing. Karibu sana, nataka uniambie unaitwa nani, na labda uniambie hii jambo hili ambalo unaona hapa mnalifanya kwa nini, na labda unaona ni kama linasaidia.
Kwa majina naitwa John Maina, nafanya kazi kwa kampuni ya Nyeri Shuttle. Tumeshukua hii jukumu kwa sababu ya ugonjwa iliabio imekuja tusuie. Ndio watu wakiingia kwa gari tunawaosha, tunaambia kitu ya kufanya hiyo kitu ni nini, na ndio tunaendelea. Mimi nauliza wenzetu kama wengine wa matatu wafanye hivyo ndio tusuie hii ugonjwa, sababu hii ugonjwa inaonekana kama jaga inakuja.
Na pia umeambiwa kwa magari, mkiosha magari mnatumia vitu kama sanitizers mkiosha magari. Labda kuna mbinu ambazo mmetumia zingine zisipokuwa za kawaida kuhakikisha kwamba mkiosha magari yako safi vile yanafaa?
Magari zetu tunakuwa safi kila siku, na sasa tunasiosha, tunaambia watu waoge, na ndio tunawekea maji ya kuoga, tunawekea kitu safi ya kusafisha mkono, ndio tufanya nini tutimisha hiyo magonjwa.
Asante. And Sam, I had a conversation earlier with a gentleman which I found very interesting, and I want us to have the conversation. Karibu sana, nataka uniambie unaitwa nani na unafanya kazi gani, na labda uniambie kwa masuala haya yote ya corona, wewe unajua jinsi ambavyo unafaa kujizuia wewe.
Kwa majina naitwa Timothy Dhoita, mimi nafanya kazi ya bodaboda, lakini ile mambo mengine naona mambo ya kujikinga, nasikia mambo ya shule, watu wa magari wamewaambiwa wao na mambo ya kuosha, lakini sisi kama watu wa bodaboda sijasikia mambo yetu. Sasa tunataka watu waambie tutakuwa tunajikinga aje, sababu za zingine unabeba customer unamweka, ukikuja kabla hujafika town unapata customer mwingine, tutajikinga aje?
Sam, I just wanted that gentleman to express his concerns, because he says that he's of the opinion, or he has not heard, he as somebody who operates a border, like they're commonly called, does not know what it's supposed to do. And he says that they've had instructions to schools, instruction to other operators, for example, the matatu operators, and now he feels that if there is a way that they need, or if there's a special way that they as a group need to protect themselves, then he would appreciate if that information is given. Some, I must also say, the schools that are schools around here, I've actually received some calls from parents from Kagumo High. They say they've gone to pick their children. They're just waiting for the children to be released, or the students to be released. At the same time, we expect the county government of Nyeri to issue a statement later today concerning the level of preparedness. We know in Nyeri County, for example, one of the hospitals, Mount Kenya Hospital, has been identified as the facility that would be used in case of a corona virus coronavirus outbreak in Nyeri, and we understand it has about a capacity of handling 25 patients in there, because the wards are special. The wards are kind of isolation units. Each patient will have a ward, and at most 2 or 3 patients can share a ward, and so it would be easier to be able to manage these patients. It's a conversation that we're going to be following later to see, for example, if the county government and also the national government representative here, who is a county commissioner, if they're going to be issuing any directives or any guidelines in line with the presidential directive of ensuring that gatherings do not necessarily happen unless they really have to. We're going to be following that. So from here, Sam, we're just going to take to do a spot check in schools to see if the borders have left. As I was talking here, Sam, I did see 2 students walk, and now the question of how students are going to be going home from school also comes out, because some parents can be able to pick their students, their children. What happens to those who do not have parents who can be able to go pick them? These are some of the questions and some of the things that we'll be seeking clarity on from the administrations, also from the schools. Back to the studio, Sam, from Nyeri County. I'm Martin Munene.